For people with trauma, therapy can feel impossible, not because they don't want to heal, but because their body doesn't feel safe enough to start. They sit down, try to open up, and something locks up. It's not avoidance. That's a nervous system still wired for danger. Trauma-informed therapy understands this. It doesn't ask you to dive in. It starts by helping the body exhale. Because without safety, there is no trust. And without trust, nothing opens. Being trauma-informed doesn't just mean being gentle. It means knowing how trauma rewires the brain and body. Hypervigilance, numbness, disconnection. It means recognizing that behavior is protection, not defiance. So instead of forcing disclosure, trauma-informed therapy meets people where they are. Gives them choice. It tracks the nervous system, not just the words. It asks, what does safety look like for you? That question alone can change everything. You can't talk your way out of trauma because trauma lives in the body, not just in the mind. When you've lived through something overwhelming, your body doesn't forget it. It stays alert, tight, ready, even when you're not in danger anymore. Trauma-informed therapy starts with the nervous system, learning to notice tension, to slow down, to teach the body what safety feels like. Sometimes, for the first time ever. In traditional therapy, pushing for breakthroughs can backfire. Someone shares too much too fast, they might shut down completely. That's not progress, it's retraumatization. Trauma-informed therapy knows the pace matters. It respects the body's thresholds, helps people build capacity, not just confront pain. Because healing isn't about catharsis, it's about integration. And that only happens when the system stays online. Trauma often begins with a loss of control. So healing starts by giving it back. In a trauma-informed space, the client sets the pace. They choose what to talk about. They choose when to pause. They learn that no will absolutely be respected. And this isn't coddling, it's repair. Every moment of choice rewires something because the real therapy isn't just in the words. It's in what the process teaches the body to believe again. You don't need to have survived a disaster to benefit from trauma-informed care. Chronic stress, emotional neglect, medical trauma, all of these shape how your nervous system functions. Trauma-informed therapy isn't about what happened. It's about how your system adapted. And if those adaptations are still running the show, this kind of therapy helps you update them. Not by digging for pain, but by building a new sense of safety, one moment at a time. Sometimes it's just sitting still without panic, noticing your breath, feeling connected, being able to talk about something hard without dissociating or shutting down. That's what trauma-informed therapy makes possible. Not just processing the past, but reclaiming your ability to be here, clear, present, and no longer stuck in survival. If trauma has made therapy feel impossible, trauma-informed care might change that. We work with people who thought they couldn't be helped, and we meet them with safety, not pressure. Call us at 844-590-0403 to talk about your options. And if this video helped you understand something deeper, like, comment, and share it with someone who needs it.